Hey everyone, today we're going to give a little bit more informal of a presentation. Uh, as we head into the upcoming school year, we wanted to talk about a more timely issue, which is being back in person in school and the nervousness and anxiety a lot of us might have about going back in person in the midst of the ongoing pandemic and the constantly changing COVID-19 guidelines and issues. So, as we mentioned before, we have a survey. The link to the survey is here, and it'll be posted in the YouTube description and on our website, and we'd love for you to fill that out when it gets released on the 23rd. But without further ado, we'll get on with this.
So the first thing I wanted to talk about was this discussion question. So in the chat or unmute your microphones, whatever. Um, to answer this question. So why is this topic of COVID-19 nervousness and back to school talk important to discuss? So Jennifer said it's important to understand how we are feeling to better handle them. Yeah, I definitely agree with that. And we're actually going to touch on that a little bit today in our later slides. So look forward to that. Yeah, definitely. Robin talks about how it's discussed in casual settings between peers and drawing a more larger platform um, awareness of this topic is important. So yeah, definitely agree with that. Um, and yeah, there are definitely a lot of people who are nervous about going back to school. I definitely feel that way, given how large UW classes are. Um, and so, yeah, it's pretty important to talk about, especially with a big university such as UW. But yeah, cool. Um, yeah, definitely a lot of misinformation. We're going to touch on that as well. Um, for time's sake, we're going to go on to the next slide. So I'm going to be talking about some quick mental health statistics during the pandemic. And so um, from the CDC in June 2020, they surveyed about 5,000 people of US adults, so 18 plus, across the United States. And they reported that there have been elevated adverse mental health conditions. And specifically, 40% of these individuals reported struggles with mental health, such as substance abuse and also anxiety and depression. Additionally, those who are younger adults, at risk youth, racial and ethnic minorities, essential workers also reported these elevated mental health concerns. And so it's also important to keep in mind the population that we're talking about, especially with COVID-19 nervousness back to school. We talk about college students as our main, or not just college students, students in general, as our main population. And it's important to keep in mind that prior to COVID-19, this population was already highly susceptible to mental health issues given the nature of their lives and development. And so this is an important point to draw attention to. Additionally, I wanted to supplement you guys with more statistical information. And so this is from the JED Foundation. It's a nonprofit mental health advocacy group. And this was a survey conducted in 2020 on their website. It was a web based survey, and it covered around 200 college students across the entire United States. And so the chart on the left here uh, is talking about the main concerns that individuals had during the pandemic. So the length of the pandemic, racial unrest. And I just thought this was jarring because during the pandemic, I definitely felt resonated with many of these concerns, and it's being represented in a survey. So kind of feeling like um, my thoughts weren't so out of the ordinary or such. Um, and I'm sure others have thought the same as well. Additionally, the chart on the right talks about the mental and emotional health challenges that people have experienced in the past month. And the big one was the anxiety, which with 82% of participants identifying with this. And so um, this is important to highlight given that we're talking about COVID-19 nervousness and also the other ones, social isolation, 68%. These are just really high levels and they're important to draw attention to. So we're going to be drawing a little bit more attention in our next slides as well. And then additionally, we're going to talk about the importance of mental health, especially during pandemic, and why it's important to talk about it. So, with such heavy media coverage of COVID-19, such as like you turn on the TV and watch a few minutes, there definitely is going to be a segment on COVID-19 somehow, right? And so, with this comes large amounts of misinformation. This can be in part due to politicians, just the general public being skeptical of public health officials and things like that. With this, that causes increased anxiety and, again, like I said, skepticism. And so, to give an example of that, just talking about our COVID vaccines, 50% of the United States is currently vaccinated, and that's only half of the US, which means that millions of individuals are still skeptical about the COVID vaccine, and are sort of unwilling to go get this vaccine due to misinformation, anxiety, just things like that. And so, um, given this anxiety and misinformation, it takes a toll on one's mental health. Additionally, there are also issues with job furloughs and layoffs. With the advent of the pandemic, lots of people lost their jobs, especially people who are in labor companies, those who are not capable of remote working or remote learning, things like that. And so, um, those who suffered through that experienced financial instability, and with that, in part, comes insecurity. And so, that can definitely also take a toll on mental health. Um, Lastly, I wanted to draw attention to this one specifically. This is increased dependency on technology. And so with COVID, everything became remote, and our reliance on having a working device and working Wi Fi um, was highly dependent on what we did in our day to day basis and how we connected with others and how we actually got educated. For example, Europe went all remote, all the classes were remote. And so if you had bad Wi Fi, it would be difficult to listen to your teacher speak, interact with your peers on Zoom, um, and also even get your work done because everything is so heavily technological based. And so that was definitely a large issue and definitely took a toll on mental health of college student populations. Additionally, this social disconnect have as humans we need to have physical connection, and so with remote learning and remote interaction with others, that took a toll on how we saw social life again. And that also goes hand in hand with social media use as well. Increased social media use can be a good and a bad thing. A lot of the times we use social media to boost our platforms such as Pup Support. And a lot of the time social media can be um, disheartening because of the cyberbullying and the internet. People on the internet are just cruel. And so with that, there are pros and cons of that. And additionally, financial barriers. I sort of mentioned this already, but financial barriers to education. Um, if you don't have great working Wi-Fi because your family can afford it or you can't afford it, um, that takes a toll on your education. And if you don't have a working laptop, that also takes a toll on your education. And so, given all these we see a higher prevalence of mental illnesses. And so, to give a few examples, substance use disorder, eating disorder, anxiety disorder, and mood disorders become more prevalent with the advent of the pandemic.
And continuing off of what Christine was saying, COVID has had a lot of social implications in all of our lives. Quarantine and all the various pandemic measures have challenged our social lives in and out of school. Some of the impacts it's had has been increasing the screen time we spend daily, uh, increasing the amount of time we spend indoors versus outdoors, making it harder to meet classmates or make new friends. Some people who entered college during the pandemic have never met one of their peers face to face, making it very difficult to connect with a classmate, connect with being a college student and having that identity. And additionally, there's been a limited ability to participate in clubs and activities, which have also always been a huge part of the social atmosphere and interconnections within the college environment. I think most of us can name something that we missed due to the pandemic, whether it be a study abroad trip, a volunteer opportunity, a sports season, time with our loved ones, or any multitude of other things. And that has impacted our mental health, our emotional health, and definitely our social lives. But even though many of us look forward to getting quote unquote back to normal, it might not be as easy as we'd like to, including socially. We may have gotten a bit used to our more isolated pandemic lives, and readjusting to an in person social environment might take time. So, what we ask of you guys is to just be patient with yourselves. As we head back to school, a lot of us will be living in shared housing and shared living situations. Some of that might look like shared dorms, apartments, houses, Greek housing, or many more living situations. And this shared living might introduce some concerns for dealing with COVID-19. So, some potential issues might be an excess of visitors to your living residence, socializing and partying beyond your comfortable limits from roommates or housemates, or one or more of your roommates getting sick or getting COVID. So, some strategies to deal with that sort of thing is implementing house rules and guest policies from the beginning, having an open communication between roommates and housemates so that you can establish those house rules, talk about your comfort level and your boundaries when it comes to COVID-19 visitors, sanitation, and that sort of thing, as well as making sure to communicate with each other about contact tracing and symptoms, and agreements and plans on how to help and protect each other if someone gets sick. Whether that means wearing masks inside the living space, isolating from each other, quarantining from people outside of your living space, and getting tested as soon as possible, and deciding how a sick person will get food, laundry, and other essentials with as little contact with others as possible. And of course, what might be most obvious for all of us is concerns for our physical health. Concerns about the possibility of getting sick or getting a loved one sick are absolutely valid. And it's vital that all of us do what we can to personally protect ourselves and others. And, just from the depth of our hearts, we really advocate for you guys to get vaccinated, to practice frequent hand washing and alcohol-based hand sanitizer use, and to follow current CDC masking and social guidelines. And know that your university is following those guidelines to keep you safe too. That UW is, in particular, is implementing regular COVID testing, isolation procedures, contact tracing, etc. And hopefully that can put your mind at ease a bit more about your concerns for your physical health. And so, just one more discussion question. I wanted to ask you all, as we approach the start of the quarter, what are some things that you personally are nervous about, especially in relation to COVID? Jennifer says, on the bus, people judge her for wearing a mask. Yeah, dealing with judgment and peer pressure about wearing masks and, people judging you for wearing a mask is definitely an interesting thing. It's not pleasant. Especially we started to open up a bit more, and now we've kind of implemented more restrictions again, and that's been difficult on people to go kind of backwards. It feels like taking exams that aren't in the comfort in your room anymore and commuting. Yeah, there's definitely concerns about like it's a really different approach to school now, not just socially but academically, and um, it will take time to get used to. I think some people are worried that it's going to be um, more difficult commuting, definitely. Meeting and socializing with new people again after a year and a half. Yeah, we talked a bit about that. And some people told me that Asians are the cause for COVID entering the US. That is a really, I'm glad you brought that up, Jennifer. Obviously, bias and stereotypes and discrimination has been a very real thing during this pandemic, especially racism towards Asian Americans and Asians across the globe. And hopefully, as a community, we can all do what we can to dispel those myths and to advocate for truth and for the Asian community. Yeah. I think we'll move on. Thanks everyone for your participation. That was great.
All right, guys, that brings us to this concept of the new normal. I think this is a phrase that has been thrown around a lot, and I mean, we've all lived through this pandemic. I'm sure, I mean, we already pointed some out, but I'm sure we can all point out aspects of our lives that have changed, whether slight or significant, how our mental health has been affected, and the social implications that Zoe just spoke on, I'm sure are likely lived experiences for us all. So, how do we navigate this when, as a community, and really the world, like, we're still searching for a way out of all of this? Um, I'm sure we've all heard and at some point said things like, I can't wait for this to be over, or when will things be normal again? And the truth is, at least for a lot of people, achieving that normality is going to take a lot of time and a lot of work, and we really are in this together. So, what about our current state, this new normal that we're experiencing? I know we just had a discussion question, but I think it's appropriate for us to have a little conversation about this. So, I just wanted to check in on you guys. Like, how are you doing? Have you given thought to this new normal? How do you feel about it? Feel free to share some responses since I know a lot of us have had this on our mind. Jennifer says, I feel better about going to public areas if I know people would would hold up to the norms exactly. Like these standards that we now have, which again, like normality, it's all about what is the current norm, right? Like what is the current standard? Very true. Jennifer says, I feel like it's just better for public health in general too. Absolutely. Um, Prioritizing public health and safety. And, uh, you know, like it's crazy because I don't think a lot of us expected to be this divided, or at least to see our country or the world be this divided on an issue of public health and safety. To some people, it's really political, which kind of blows my mind, but Noah says, it was definitely weird going to different states. Yeah, where their normals were different. Absolutely. And I'm actually sure, because Zoe, Christine, and I had this conversation, and I'm sure they probably have something to say too, because Zoe's in North Carolina right now, and Christine just spent some time. Was it Tennessee, Christine? Like maybe there were certain norms or like,
Yeah,
yeah, yeah, yeah. You guys can
yeah.
totally
And
share.
yeah, I went to Tennessee about 3 weeks ago, something like that. because my brother lives there, and they definitely have a different sense of combating COVID. In terms of mask wearing, nobody really was wearing it, and my brother's a pharmacist too, and he was just telling me about the vaccination rates there, and they're getting higher, but there still is a lot of skepticism um, about the whole vaccine situation there. And so, yeah, it was definitely different than Seattle. And
Yeah.
seeing people like that kind of made me mad because um, not to blame them, but to blame them. But it was, yeah, it's people who don't get vaccinated and don't follow public health concerns is sort of concerning. So, yeah.
And I mean, we're gonna have to cut the conversation short so we can move on, but no, like, absolutely. It's totally valid for you to feel frustrated. Like, I know I have. It gets really frustrating when you think about, like, where you are and where your country is and the privileges that we have and how people are literally dying because they don't even have access to the vaccine, let alone a choice. I guess I'll move on. But yeah, we've talked so much about this, how our new normal is understandably hyper focused on keeping our physical health in check, which is, again, super important because that's how we're going to make it out of this. But as always, let's not forget about our mental health. It's just as important. And a way for us to really treat both our physical and mental health is by incorporating healthy habits that can benefit them both. So I know the things I'm about to say, like, we have all heard before, but I'm hoping that our discussion today really provides a good framework that will hopefully reinforce a lot of these tried and true habits. So things like getting regular exercise. I know that was really hard, especially when the gyms were closed. A lot of people are anxious to be in a fitness center, understandably. You know, again, some places don't enforce masks, and everyone's working out, they're huffing and puffing, everyone's in a tight space. Like, these are understandable anxieties. So, hopefully, you can find a space outdoors where you are at least getting some fresh air, taking some walks. I think these small breaks are actually the ones that are truly underrated. There are also mind and body exercises. So, yoga is an example. And I know not everyone is into yoga, but these mind body exercises can also just be simple breathing exercises, which is really good for everyone. These are healthy practices that have been proven to reduce your stress, lower your blood pressure, and really invoke that sense of relaxation. So, when you're feeling like you are in the thick of it, I want you guys to try these long, slow, deep breaths that everyone talks about and just to really focus on your mental state. It will help a lot. Other things that really can make a difference in how you feel, both physically and mentally, include your diet and your sleep. And I know I listed healthy eating here, but when I say that, I'm not just talking about getting your veggies in, because often when it comes to our mental health, it's pretty important to focus on our relationship with things, including food, and not only focusing on what is healthy, but also our feeling of contentment and feeling good, feeling happy. Healthy sleep habits. Sleep is something I know a lot of us, especially college students, struggle with, and a lot of it is due to, like, this culture of the grind, which I know I'm also personally at fault for, but don't sleep on sleep, okay? Not just how much sleep you get is important, but how you're getting it. So look at your sleeping habits, your patterns, and really assess whether or not it's working for you as a student, whether or not it's having effects on both your mental and physical health. So that's great and all, everything I just said, but really, while those are all important points, most of it focuses on that generic surface layer of what we are experiencing. So, what happens if adopting those healthy habits isn't enough, which for a lot of us isn't? How can we cope with our feelings of anxiety? One of the very first things we can do is to recognize and acknowledge our feelings of anxiety, that these feelings are valid and it's okay to feel this way. Tell yourself that it really does not feel okay right now, but we can work to create a plan to cope with it. And I'm sure if you go online, which a lot of people, like everyone does it, okay, a lot of people who are experiencing these symptoms, they will, and you search online, there are going to be so many great resources with different methods and techniques for you to try out. And I'd also like to stress the fact that you should experiment with all these techniques and don't give up. What works for someone else, it might not work for you. But once you find your way, like your own way in grounding yourself and healthily working on these feelings every time they arise, trust me, you're growing and you will get to and hopefully feel that you're in a better place with your mental health. Another stop in this is when to seek professional help. So truly, seeking help, it can happen at any time. Talking about our mental health and working to improve it is for everyone every day, okay? But let's say you're not improving. Your day to day is just, it's affected really bad. You're unable to sleep, you feel constantly fatigued or on high alert. You know, you're not feeling good in your own body. You feel that you're socially withdrawing more and more. When it's come to a point where it's affecting how you're moving through your day, like how you're thinking, concentrating, interacting, you really should seek professional help. And, you know, whether this is through therapy, one on one, or group therapy, group talk, or speaking with your primary care provider or psychiatrist about possible treatments, this is that self advocacy step we always hone in on because you deserve to not just feel okay, but to feel better. And of course, our focus today in the presentation is on students. So seeking resources is key. I actually say this a lot just in general, like just to everyone I know. One of the biggest pieces of advice I can give to our undergrads is to really take advantage of your campus resources. I wish I did this sooner. Because even before this pandemic, college was a hard place, okay? And I personally have seen a growth in mental health resources and outreach, especially since the pandemic hit. Our state of mental health, I feel, is something we are finally normalizing as we should. And it's so important for us to continue forward with this culture of acceptance, but also our active progression, right? So please, when you can, act as an advocate for yourself. Know that it's okay to not be okay, but it's also okay to seek help for everything that you might be shouldering. And lastly, like, I know this is kind of heavy. I know this presentation probably hits home for a lot of us, but let's try to end it on a slightly more positive note. Let's try something, okay? When we are feeling our anxiety, I know it's hard to control our thoughts and to stop ruminating, but I'd like to say a technique you could try is instead of working to control these thoughts or always stop them from happening, which kind of contradicts our whole point of, we want to validate these feelings, right? What can we do instead? We can work to challenge them. So for every negative thought, try to reflect on the root cause. Why are you feeling this way? Ask yourself, is your anxiety due to an external cause? Can it be changed by recognizing patterns in your thoughts and reframing and challenging these thoughts? So for every negative thought you have, try to challenge it with 3 positive, affirming thoughts. And we're actually going to try this right now, so hopefully you guys are down for one last exercise. This is a thought I wrote out here, so I'll just read it real quick. I know that we are progressing to being back in person, and that there are systems in place to protect us, but I still can't help but feel anxious. What if this is too soon? I just know that things are not going to be the same at school. So thoughts like these are normal, these feelings are valid, but what are some things we might say to ourselves or do to counter this thought and to improve our headspace? Jennifer says, the vaccination rate is increasing and people are now aware and cautious about this issue. Yes, I really like that because that is true hard fact, okay? That is science right there. I personally feel like knowing something is a fact, like that can really dispel a lot of these negative thoughts that often are just us. Like it's just us, okay? It's us building up on that negativity and kind of snowballing it. So yeah, I really like that, Jennifer. Noah says, No more awkward breakout rooms over Zoom. Yep, exactly. Social interaction. It's probably gonna be awkward at first, but like we're gonna get there again. So I like that, Noah. That was funny. Yes, there are rules, regulations, and mandates in place to make sure we stay safe. I was kind of hoping someone would catch this. That very first sentence, I know that we are progressing to being back in person and that there are systems in place to protect us. But I think a lot of times that's how we ruminate. We say something we know is just hard and true, and then we say, but blah, 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 you know? But maybe we could have just stopped there. And again, we're not trying to control these thoughts, but if you reflect on that thought and you think to yourself, well, but then again, I just said, like, there are systems in place to protect us. There's systems in place to protect me. Like, we're gonna be okay. So thank you, Robin, for finishing that. That was actually perfect. That kind of completes the exercise. So our next slide, as always, guys, is our resources slide. So I'd also like to highlight 3 resources at the very bottom of the presentation. Yeah, the 3 resources at the very bottom are UW specific. Christine actually told me about Live Well, which I didn't know about. But I checked out their website, and there's a lot of good stuff on there. A lot of like services they provide for students, educational workshops, and I think they have something new, peer wellness coaching. It's a new free service, so I really encourage you guys to check that out. And I also included 2 resources specific to UW at the bottom too for the whole U and UW Culture of Care. So these are meditations and mindfulness exercises and workshops that you can attend remotely. Otherwise, I want to thank you guys for being interactive today. Thank you for listening to us. Reminder, breathe, make boundaries for yourself and your happiness, and we will talk to you guys soon. Thank you.